Record right now. So we're recording, and if I can remind everybody, if they have Zoom call questions that they don't want to ask live for whatever reason, you can email them in. Just make sure, please, to put in the subject line of your email Zoom call questions, because we get literally maybe 200 emails a day, and it will get buried. So make sure you do that. Secondly, reminder, if you ever email me questions and I don't get back to you, don't think I don't like you. That's not, make sure you call and make an appointment to talk to myself or Dr. Halderman or Angie or Michelle, because your email will get buried and we won't see it. So I apologize for that. Okay, so before we get started, does anybody have any questions that they want to talk about right now before we get started?
Dr. Connors, I have one little question to David out of Massachusetts. Hi there. It has to do with the flu shot. I've not gotten the flu shot, and I haven't in many years at this point, and I've done just fine by it. But I did have an appointment yesterday with my PCP. They strongly suggested it, and I simply said thanks, but no thanks. What's your take on this?
Do you really have to ask me that question?
I guess so.
Okay, so you do not know me very well, do you? So I'm just teasing you, sorry. But no, should you get the flu shot? So I'm trying to think of a reason why someone would want to get a flu shot, and I'm at a loss for words. So there's multiple reasons why you wouldn't want to get a flu shot.
Yeah.
And one being that it's not going to really protect you from the flu. There are so many varieties of influenza out there. By the end of March, when quote-unquote flu season is starting to die down, the Centers of Disease Control will have identified on the average between 700 and 1,200 varieties of the flu that have been out that they identified over the course of the last 6 months. Now, they use those to decide on what to put in next year's vaccine, which they only can pick a maximum of 3. So they'll pick 3 things to put in next year's vaccine. You do the math on that, and it's just idiotic to think that getting a flu shot is going to help you and prevent you from getting the flu. Secondly, in order for a vaccine to work, it has to stimulate a Th1 and a Th2, or a B cell reaction, and develop antibodies against that virus or bacteria that you're trying to vaccinate that person against. So just because a person gets a vaccine does not mean that they have immunity against that particular organism that they're vaccinating themselves from, which is absolutely evident in the amount of people that got the flu that had the flu shot, and it's evident in all these outbreaks of measles people that got the measles vaccination. And all the other outbreaks of diseases, most of these people were vaccinated, and yet they blame unvaccinated people for spreading this. It's like, okay, if you're vaccinated, then what in the world are you worried about this infection that's going around that you're supposed to have antibodies against? Well, the truth is, they don't measure antibodies in that person. Years and years ago, they would give a person a vaccination, and then 3 weeks later, they would measure that person's blood for antibodies against that thing that they vaccinated against. And if they didn't have antibodies, they would revaccinate that person or re-inoculate that person because it didn't work. Well, they stopped doing that because, why? Because they don't like doctor's visits and making more money? No, because the high percentage of people that the vaccine didn't even work against. So I could go on and on for about 2 hours on the subject of vaccination, but vaccination is not the way to develop an immune system and not the way to develop an effective response against any organism in your environment. So I think I've made multiple videos on vaccine. There's tons of information on vaccines. I would highly suggest if you feel pressured by family members or doctors about the subject that you Google There's a movie called Vax, VAXX, that's out. That's a documentary that's wonderful. There's other documentaries that can really enlighten you on the subject and will probably inflame your anger at what the whole vaccine industry is doing to the populace as a whole, because it's damaging people, it's leaving people with brain inflammation, it's leaving kids with ADD, ADHD, and all sorts of problems, and it's a crime against humanity in the very least. Um, uh, Many people believe that it's an attempt to limit population control, and that has been proven out with vaccines that have been administered in Africa, where young girls are sterile because of that now. And I could go on, and it's not conspiracy theory stuff anymore. I used to lecture against vaccines 20 years ago when I was a total crackpot, considered by everybody. Well, I'm still considered that, but it's now a badge of honor, so thank you very much. But I would highly recommend that you go to YouTube. There's a lot of people that are a lot smarter than I am that were very much in the pro-vaccine camp. I heard a wonderful woman, Dr. Kelly, if she's on here, probably remembers the lady's name who I'm talking about, who spoke at Ben Lynch's seminar a couple of years ago, who worked for the CDC, and she did a lot of work in the pro-vaccine movement until her eyes were enlightened, and she now speaks against it, and she literally fears for her life. So it took way too much time to say, no, don't get vaccinated, but don't get vaccinated.
Hey, I appreciate that. No, I'm not getting pressure to anybody, but thank you for the input.
Yeah, and
I think some of the schools, like, they won't let the kids in unless, I heard of that mom that got thrown in jail for not.
Yeah, there are some states that do not have the ability for you to opt out. I know in Minnesota, and many states have 3 different ways to opt out. You can opt out via a religious exemption. There's an exemption just for a parent to say, we don't want to do this, or you could get a doctor to sign the exemption form saying this is not in the best interest of the patient. So there's a few states that are very controlled by the pharmaceutical industry. I know Connecticut's one of them. I don't know all the state laws, but there's some states that are forcing children to be vaccinated in order to go to school. I know California is very pro-vaccine, and but as an adult, you have the option to opt out unless you're in a career like a doctor in a hospital or a nurse in a hospital where you're forced to get a vaccine in order to continue to work there. But there's a lot of pushback against that.
I was so impressed at the hospital that I go to. One of the nurses was wearing a mask, and I said, she goes, I'm not sick, she said, but I won't get the flu vaccine, so they make me wear this.
Yeah.
And I give her credit for wearing that.
Yeah, that's right.
Because of her convictions.
That's right.
And would you also say that, like, when they tell you you can't get sick from the vaccine, I know people who get sick right after the shot. Is that true?
I would just say you're a misinformed person. So I wouldn't say that at all, quite honestly, because I wouldn't be in the position to have to say that, because I wouldn't have gone to them in the first place. But if I was in that position, I would be nice and I'd say thank you very much, and I would bite my tongue. But what I would like to say is a whole different story. But it's, you give up arguing with people that don't want to have their eyes opened, and you're just basically casting your pearls before swine, and we're told not to do that. So yeah, just say no thank you and move on. And if they argue with you, put your fingers in your ear and go la 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 la. Works for me every time. Okay, we do need to move on because I got a whole bunch of questions to go over here. So feel free to interrupt me if you can, and we'll talk about anything else too. So here's some questions that came in. Are there benefits to drinking alkaline water? I've read conflicting information about this, and I'm not sure what to believe. Good question. So this is a common question, and it's commonly up on different websites and Facebook groups that if you want to kill cancer, you just have to alkaline yourself. So start drinking baking soda, buy this alkaline water machine, start drinking this 8.8 pH water and everything, and you're going to be cured. Now the problem with that comes from Physiology 101 that says that your stomach pH has to be at a very low pH, between some people say 1.5 to 5. Now that on a pH scale, that's very acidic. And it's very acidic because one of the purposes of your stomach is to digest food. So what digestion is breaking down foods into small particles, and the acid in your stomach is mainly responsible for breaking down carbohydrates into small particles so that you can absorb them. So when you drink alkaline water, or you're going to drink baking soda water or something, all you're doing is alkalizing your pH in your stomach. Now, I would argue that maybe if I have esophageal cancer, or if I have stomach cancer, or if I have duodenal cancer, or even colon cancer, there can be some benefit to drinking alkaline water or baking soda solution between meals. Not with a meal, but between meals. So I don't want to step on toes, but there's people probably on this call that have a Kangen unit or something like that that alkalizes their water. If you want to do that, I have no problem with that, but don't drink it with your food. You need your pH of your stomach to be very acidic in order for you to digest your food, or you're just alkalizing your stomach and then trying to digest food and then wonder why you have gut problems. So that's the conflicting thing. So with everything that you read on the internet and everything, just, it's not all really true. So I know you that people would argue with me if they saw it on the internet, it's got to be true, but not everything is true on the internet. So just great question. I don't think there's anything wrong with alkaline water, but just don't drink it with your meals. And I do not, personally, I don't believe drinking alkaline water, or even drinking a stronger alkalinity like a baking soda or something like that, is going to alkalize your tissues. It's only going to really alkalize maybe your stomach and your small intestine, part of your small intestine, possibly your colon. I doubt that it's going to get that far, and I don't think it's going to absorb across and alkalize your body, because how food and how anything that goes into your intestine absorbs across, it absorbs into your blood, and your blood has got a buffering system, and your blood has to stay at a pH of about 7.4, or you die. You just die. So if you all of a sudden injected sodium bicarb into your blood, it would probably kill you. But if your buffering system is very healthful, you will buffer that back to 7.4. So if you think, oh, I'm going to drink this alkaline water and it's going to alkalize my tissue and help my thyroid cancer or help my uterine cancer, no, it's not. If it did, you would die before it got to your thyroid cancer or your uterine cancer. So your body would be working very hard to buffer that. Truthfully, I don't think it absorbs and anyhow. So, but it's going to definitely alkalize your stomach.
Under the same principle, does taking magnesium with a meal do the same thing?
So magnesium and minerals are going to be more alkaline, right? But magnesium is not going to change the pH of your stomach, and a capsule of magnesium is not going to be completely broken down in your stomach anyhow. It won't be broken down till somewhere in your small intestine. So I wouldn't worry about taking a magnesium with your meal. No, I wouldn't be concerned about that. Question about enzymes and cancer. I have a number of people taking enzymes based upon Dr. John Beard's work and Dr. Nicholas Gonzalez's work. if you know who these people are, Dr. Nicholas Gonzalez was a doctor from New York who was a mentor of mine and a good friend of mine, and he has passed away a couple years ago. He's a wonderful guy. He's got a number of videos on YouTube. I highly suggest you listen to some of his videos. He's just a super guy. He studied Dr. John Beard's work and about enzyme therapy, and it's that work that has been shown to be very effective in certain cancers. Typically, enzyme therapy, you think of enzyme therapy with pancreatic cancer, but it can be helpful with other cancers as well, mainly of the digestive tract. So the question was, with somebody who I have on higher dose enzymes, is what can we do if enzymes taken on an empty stomach for cancer cause a full feeling? Well, there's not a whole lot you can do. The problem is if you're taking 5 to 10 to 15 capsules on an empty stomach, you're drinking a lot of water with that too. So that's part of the problem. Now, can you open up the capsules and put it in this is one way I've had other people do it. Open up the capsules, put it in a little shot glass, add a little water to it, mix it up with something, and then you shoot it down, put a little more water in there, shoot it down, so you're not drinking so much water and getting the capsules themselves, which can cause a full feeling. That's one way to do it. Second question is, can the enzymes be causing a loss of appetite? I don't know. I mean, surely anything can happen. There's not a lot of data, and I haven't seen that it causes a lot of loss of appetite. Maybe it's just because of the capsule itself that is just kind of filling up the tummy, because you have to digest that as well, and that could be doing it. Try opening up the capsules, putting all the powder in a shot glass, adding a little water, mixing it up to a sludge, shooting it down, filling it up with water to get all of it down, and see if that works better. That's what I would do. Can they spread out or over the day, or would that not be effective? The problem is when you're taking enzymes, so there's two ways to take enzymes, remember. You take enzymes with your food to digest your food, or we're taking enzymes on an empty stomach to absorb, so it helps break down the biofilm of the cancer. That's what we're trying to do with enzyme therapy for cancer. So taking higher dose enzyme to help break down the biofilm of the cancer, and so then it has to be taken on an empty stomach. So spreading it out, not really. Breaking up the open up the capsule is what I would use. Next question. Say a person's blood work has never shown any signs of being abnormal in any way, yet that person was still diagnosed with cancer. Okay, let's stop right there. So most people are not going to get a diagnosis of cancer because of their blood work. So blood work, a CBC count, or a liver profile is not going to show cancer. It can give us hints, and there are, in normal blood work, there are called ominous signs. So let's say one ominous sign of cancer is my protein levels being off, my albumin and globulin levels being off. Another ominous sign would be, having liver enzyme function test off, like AST and ALT and alkaline phos through the roof. Oh boy, that tells us something's going on in the liver. Well, that could be fatty liver too. That could be a toxic liver. That could be hepatitis. But that could also be cancer to the liver. Another ominous sign is, oh, my cholesterol, my cholesterol was always at 180 and now my cholesterol is 110. Whoa, that's an ominous sign. So there's something going on. But nothing in the blood except for a cancer marker test, which, if you have ever had cancer marker tests, you know that they're not always accurate, and they're only run when a person has a diagnosis of cancer. So they're not used as a cancer screening tool. So there aren't any blood tests that are going to be definitive of cancer unless you're doing a specific blood test like the IvyGene test. So I have to get this, whoever's asking this question, to understand that my question is, say a person's blood work has never shown signs of cancer. Okay, well, most cancer patients' blood work will never show signs of cancer. Can I be assured that my score on the IvyGene test was somewhat accurate given my blood result or its of past history? The answer is yes, because you've never had an IvyGene test before. So remember, the IvyGene test is not a normal blood test. It's measuring the specific free genes that would be in circulating tumor cells, and it's measuring whether the oncogenes are turned on and the percentage of oncogenes that are turned on and the percentage of tumor suppressor genes that are turned off. And that's what's giving us your score. So that is only going to be found high in a cancer patient. So you can't have a score of 23 like this example here and not have cancer. I just spoke to the head of Oncogene Labs just today for a couple reasons, because the biggest thing is I called them because I am actually shocked that how many of our patients have such low oncogene scores or IvyGene scores. So my question is, could your scale be off? Because so many of my patients are stage 4 cancer patients, and yet they're coming in with IvyGene scores below 20. And well, the head of the lab wanted to talk to me right away, so we set up this time to talk because they're not seeing that with other clinics. So that's kudos to all my patients who must be following their protocols, because the first thing he said is, you got stage 4 cancer patients that are coming in under 20. We want to know what you're doing. So I said, we're praying a lot and God is healing our patients. So that was very encouraging. Now, not everybody's coming below 20, so keep praying for everybody, but it's very encouraging. And I asked him, what is the average scores that you're seeing? He said, well, it totally depends on the clientele that are coming in, but those that are already diagnosed with stage 4 cancer, he's seen scores up to the 60 range. And he said that theoretically, even though our little rating scale goes up to 75, theoretically a person could be at 100, depending on how much active cancer that they have. So I'm very encouraged with the results that we're getting. So to answer this person's question, can I be assured that my score on the IvyGene test was somewhat accurate? You can be assured that the score is somewhat accurate. No test is perfect, and there is a 1.5% plus or minus accuracy on this range. So it could be off by 2 to 3 points maybe, and I'm being overly generous there. Realistically, it's going to be off by maybe 1.25. And I did one of my questions for him. He's a PhD biochemist. Was how often do you think people should retest? And he said, really, if you got somebody that's below 20, 3 months. If they're doing fantastic health-wise, and you have to compare this with how the person's feeling, maybe you go 6 months, maybe even go longer. Was there a question that piped in there that I ignored?
Yay.
Yay? So that's a good yay. So
encouraging.
Very, very encouraging. So I'm very, very encouraged with what we're seeing or what's coming back. I did also ask the question because you'll notice on the IvyGene test that it rates it as it's being most accurate with lung cancer, liver cancer, breast cancer, and colorectal cancer. And he said actually there's 20 cancers that it is really most accurate, but legally those are the only 4 that they can list. So very encouraged with that. He said it's going to actually show, the score is going to show with any cancer, but with those 24 or those 20 total, I can't remember if he said 20 more or 20 total, but that's where it's going to be pretty spot on accurate.
Is there a way to get a list of those?
He said they can't give that list. They are in the process of finishing the studies so that it'll be out shortly, but within a year. Next question, can use of a biomat be helpful? Somebody posted on the Facebook page about a biomat, and personally, I love these things. I think they're great.
Yeah.
But just like with any product out on the market, I'd be careful, what they tell you and what its really best benefit is. So a biomat is an infrared heating pad that you lay on. And so you're lying on it and it's nice and warm and you'll probably fall asleep. And it has its benefits. Now they go into, they take all the studies on far infrared and they equate it to their biomat. Well, that's not fair because that's just not true. So they're taking studies of what does far infrared do and then what does this heating pad do? Well, the truth is none of these heating pads are true far infrared. It's for a true far infrared mechanism for a 6x6 piece of true, that's putting out true far infrared is going to probably be about $4,000. And you can't sell these biomats for $300 that cover your whole body and be true far infrared. Secondly, true far infrared has to be skin to conduct. That's why when you're in our office and we're doing the true far infrared on you, it has to be right over your skin. And that in itself has some depth to it of a few inches. This is basically heating the surface, but it is beneficial to heat the surface, and it can be very calming. It can increase circulation. So there's a lot of benefits to this. The only thing that I don't like about these units is that you can't wrap them around you really. So I've recommended on, I think, another Zoom call, those heating pads that are also, I think, really the same technology for far less money, and they're smaller. And you can put them right over your liver. Because, yeah, it's real helpful to lie on your back on this thing. It's comforting, and you fall asleep. I'm not sure how really physiologically helpful it is, though. I think there'd be more physiological benefit to having a nice infrared heating pad that you put over your liver, or maybe that you do a castor oil pack and then slap that over the top of the castor oil pack. I think you're going to get a lot better physiological benefit off of that at a far less price than these. And so that's just my 2 cents worth. So I think I posted the heating pad on the Facebook page after last Zoom call, or maybe the week before, the one that I use at home. So I would look up that as well. Next question, when doing the Budwig in the morning, is it best to take supplements before or after eating? I think that means doing the Budwig. And if after, how long? I think if you keep about a half hour away from the Budwig, either way, you're fine. So that would be my rule on most things, that you want to stay away from food at the same time so you get the single benefit of that thing. Next question, my biological dentist is getting me a homeopathic remedy that she says will help neutralize the effects of the metals that are in my mouth. I have crowns from a previous dentist with gold, palladium, I don't know, silver, tin, and indium on the inside. I have no mercury in my mouth. I will replace these crowns slowly over time. I thought I did so good by removing all the mercury, and at the time I did not even know that these pretty little white crowns have metal inside as well. What are your thoughts on the homeopathic remedy? And is there no harm to use? Well, first of all, I would be careful to, I have a rule with any metal in your body. If it's not causing problems, leave sleeping giants lie. So what that means is if these crowns, maybe they're dispersing metal every time you drink a cup of coffee and you chew and you grind against something and you're getting metal that you're swallowing, That doesn't necessarily mean that that metal is causing you problems or that you're absorbing it. You don't have absorption sites for these metals. It's when you have leaky gut issues that these metals, including mercury in your fish that you eat and such, that's when it gets across the gut border. You don't have absorption sites for mercury. It's when you have a leaky gut issue that you absorb those things. So I'd work on healing the gut and continue to work on healing the gut and be tested if these metals are even causing an issue. Because if you start using a homeopath as a chelator, which, hey, I'm all for homeopathy and I'm all for using a homeopath as a chelator, we do it all the time. So the very thought that she's doing a homeopathic remedy as a chelator, all kudos to that biological dentist, fantastic. However, if they're not causing you problems, you could just be stirring things up. And so if your dentist is testing you somehow with kinesiology or something that these metals are causing you problems, then by all means do the homeopathic remedy. But if she's just doing that because you have the metals in there, I would be a little leery of that. You don't necessarily want to, our goal isn't to pull every toxin out of every cell of my body, thereby thinking that I am helping myself. All I could be doing is stirring up more harm, because toxins can sit in cells and do nothing for 120 years. So we don't necessarily want to stir the pot. So, however, knowing that you have these, maybe it would not be a good idea to do other forms of detox that would specifically stir the pot in your mouth. Like if you have metal in your mouth, my rule number 147 is don't do any oil pulling. So you guys know what oil pulling is? When you put some olive oil in your mouth or some coconut oil and you swash it around for 10 minutes and you spit it out, because you're pulling the mercury out of your gums that you had in your teeth that you had all replaced. But if you cannot do that, if you have other metals in your mouth. So if you have any other metals in your mouth, you can't do oil pulling. And it would be the same philosophy here. We don't want to do a homeopathic or something like that to pull these metals out if they're not causing problems. They're better off just leaving them there until you can get them replaced. Okay, now all these questions, I flew through them. It's been about 38 minutes. What questions do you have on what we talked about, or any other questions? I want to get your questions answered here.
I think you said too on this last one, Dr. Connors, that you don't want to do chelation either. I remember.
Yes, so you want to be careful with chelation that you're not pulling out stuff that you will never end up pulling out that stuff. I mean, how are you going to pull? You got a piece of gold in your mouth and you think you're going to pull that out of your body? It's going to take, maybe 1,500 years. So probably not going to happen before you get to go to heaven. So I don't know.
Dr. Connor?
Uh-huh.
I have been experimenting with the Rife machine for parasites, and I ran several programs, starting with the EA, the first three, and I developed a kind of a stomach ache that seems to be lingering.
Okay, Mike, that's just gross.
I know.
Okay, sorry. Okay, so the truth is everybody's got parasites. So should people be running parasite programs? Absolutely. So can you hurt yourself running parasite programs? Maybe Dr. Kelly would think differently, but I don't think so. You're killing parasites is a good thing. The only thing that I'd be careful of, if you have Lyme disease or something, you don't want to do a whole lot of kill too fast, you're dealing with, if you got cancer and you want to start running some parasite programs and such, a good set to start with is in the alphabetical file is the Clean Me Up program. And I think there's 5 of those. So Clean Me Up 2, 3, 4, 5, or 6 of them or something. That'd be a good set to start with. If you suspect specific parasites, then you can go to those specific parasites. If you suspect flukes or roundworms or something, certainly go to those. If you got a gut ache, you got a stomach ache from the parasites, the only thing I would say is, how often are you having a bowel movement? Maybe drink more water. There's some, if you're like feeling like you're trying to do some more with your Rife because you're doing well with your cancer, then I would say you could add an anti-parasitic nutritional protocol. Like one kind of general one that we have on our website is a product called Pro-Vermifuge, and that one has a lot of anti-parasitic nutrition in there. You could take a couple of those a day and maybe cycle that on and off, like pulse it, maybe do it just every weekend. You take 3 a day just on the weekend, and you run the parasite program. So it's kind of clean you out. You're always exposed to parasites. So even if it's the same thing as with toxins in your body. You're never going to be parasite free per se, because you're always exposed to them. And even if you do a stool sample and we measure and you have no parasite activity, you still have parasites. So so it's running that on a regular basis is a good idea. There are some products that are very anti-cancer products, like berberine, that are also very good to help kill parasites, and especially bacteria in your gut. So yeah, if you have a stomach ache, just make sure you're having a bowel movement every day. Make sure you drink some more water. Maybe take some anti-parasite nutrition, and I wouldn't stop doing it. And quite possibly it's just coincidental.
Okay, well, thanks.
I hope this is kind of quick, but my daughter's having a lot of stomach issues with diarrhea, and she stopped doing dairy, which helped, and then she's stopping gluten, and that's helped, but she's still having a lot of issues and, stomach cramping. What kind of doctor should she see for that?
She should look for a functional medicine doctor. So somebody that does that in their bio says they have experience with functional medicine, and that's really what they specialize in. She wants to get testing for any other food sensitivities, she has leaky gut, that's a given. And then you go, okay, is there any other things that are causing inflammation in the gut? Well, the first thing, what goes in your gut all the time? Well, things you eat. So you want to test for if you have antibodies to any food. So a good question to ask the doctor would be, what kind of testing do you do for that? If the person's very skilled in kinesiology, you could rely on that. If they're not, the type of lab testing would be typically a lab called Cyrex lab. That's my favorite, though there's others that are good too, but our favorite is Cyrex labs. And they measure for food antibodies for both cooked and raw and different ways you would eat a food, because the antibodies are different. And by looking at that, you can see the things that person is eating that's causing inflammation. And yes, the majors are gluten, dairy. So if a person's like, well, they don't have a lot of money, what should you do first? Cut out gluten, cut out dairy. Those are going to be the biggest ones. Cut out soy if she's a female. So she, using that pronoun, will typically mean that she's a female. And but who knows these days? So sorry. But I would definitely cut out
Cyrex.
Cyrex is Cyrex.
Oh, that's what I had.
And then,
So, you'd have to find a doctor that does those type of tests.
you have to find a doctor that does those kind of tests. So the biggies are gluten, dairy, soy, corn. But then if you ran that test, it's really weird because you'll come back with, oh my gosh, it is sky high. I had some of the other day. It is sky high for peanuts, peanut butter, and all things peanut. And it's like, that was really weird. And the dad goes, well, honey, you made that ginormous batch of peanut butter cookies over Christmas, and that's when this all started. So it correlates it's very accurate. So you're going to find out what causes the inflammation. And that's good. Those are tests to run, not just for, people that don't have cancer, but as you guys start recovering and now you're starting to look just like Mike is, oh, maybe I'll start running some of these other programs like parasites that you maybe start going, oh, I want to start dealing with the mercury in my mouth, and I want to start dealing with other problems I have because now cancer isn't, the hot topic in my life anymore because I'm winning that battle. I can start cleaning out some of the other layers of the onion to get even healthier. And running a Cyrex test is something that we can do through the office here. So we do that with cancer patients as well when they get to that point. So, but that's a valuable test to look at other food sensitivities, not things so much that are driving your cancer, not really anything that's driving your cancer, but looking at what food sensitivities that are causing gut inflammation, that are causing leaky gut, that are causing all sorts of problems.
Is there any legitimacy to these hair tests that are supposed to tell you like what kinds of food sensitivities you have?
Hair analysis tests?
Yeah.
That test food sensitivity?
That's what she said her friend does that.
I'm not familiar with that. I know that there's hair analysis tests to test for metal toxicities.
Oh, okay.
But I'm not, quite honestly, real keen on the accuracy of that either. So.
Okay. Thank you.
All right. Well, we're running kind of late. Hopefully everybody got their questions asked, and keep up with the Facebook page and helping everybody else out and responding, and feel free to answer people's questions if you think you know the answer or you have some experience in something, and I know many of you have, but don't feel like you're not qualified. If you answer something wrong, I will completely bash you and make fun of you. But I'm really snarky tonight. I am really snarky. Somebody put something in my chaga tea. I don't know what it is.
I count on your humor. I count on it, Dr. C.
You got a big dose of it today.
Yeah, no, I won't make fun of you, or Dr. Holloman probably will, but not me. I'm the nice guy.
Yeah.
She's the bad cop. I'm the good cop.
I'm so amazed at how few people get in on these calls.
Yeah, well, a lot of people probably listen to them, or at least I tell myself that to make myself feel better. But
after, yeah.
So, all right. Well, thank you guys very much. We will.
Thank you.
Thank you. Thank you.
Thank you.
Bye-bye now.
Bye.
Good night.